Good morning, Ashley. How are you?
Good, how are you?
May I see your wristband? You can please state your name and date of birth.
Ashley Hoda, March 15th, 1994.
Okay, thank you so much. I'm going to be your nurse today. I'm going to give you a general health assessment. First, I'm going to start. Do you have any chronic diseases? Have you noticed any changes in your ability to move around or participate in your usual activities?
No.
Okay. Have you noticed any changes in your muscle strength?
No.
None? Okay. And if you did, I would ask how you would adapt to these changes. Now I'm going to go into your past health history. Have you ever had an accident or trauma that affected bones or joints, including fractures, strains of the joint, sprains, or dislocations?
No.
Okay. If you had, I would ask when. Or have you noticed any continuing problems or difficulties that seem related to those incidents? Have you ever had any surgery on any bones, joints, or muscles?
No.
Okay. And if yes, you would describe the procedure, when it occurred, and what the outcome was. And then I go into your family history. In your family, is there a history of curvature of the spine or back problems?
My mom does have some back problems, yes. She just has some nerves and things wrong in the back.
Okay.
I don't have any yet.
Okay. So what I would tell you for that is that we would have some primary prevention. So I want you to be aware of the risk factors for back injury. So some of the ways you could prevent that is to use proper techniques in the gym when you're like lifting weights or doing like any type of like yoga or moving techniques. Also, it's good to participate in regular exercise and proper posture at all times. Also, try and keep your body weight at a normal level, like not too underweight or not too overweight. And also, keep a positive attitude about your job and your life. Okay. And in your family, is there any history of arthritis?
No.
Okay, cool. Thank you so much.
Are there any other questions I can answer for you today?
Yes, actually there are. My mother and my grandmother both suffer from osteoporosis, so I was just wondering if I was at risk for getting it.
That's an excellent question. Yeah, since osteoporosis runs in your family, you are at a greater risk for developing it. Also, if you're an athlete and if you don't get enough calcium intake, you're also at a greater risk. Some of the other risk factors for osteoporosis include being a woman, being over the age of 35, being Caucasian or Asian, being thin and small boned, smoking cigarettes, drinking a lot of alcohol, estrogen deficiency, and not performing enough weight-bearing exercises. Also, some medications that treat chronic diseases can also lead to osteoporosis.
So is there anything I can do to try to help me not get it and prevent it?
Yeah, well, you can start by just making sure you eat a well-balanced diet with enough calcium and vitamin D. And you can also perform weight-bearing exercises and don't smoke or drink a lot of alcohol.
Okay, so calcium and vitamin D?
Yeah, and then when you're older, like around 60, you could start getting bone mineral density screenings like every other year.
Okay, cool. I'll definitely take that into account. Thank you.
You're welcome. Hi, my name is Katie and I'll be your nurse today. I hear you're having some joint pain. Can you tell me where it is and what it feels like?
It's in my left foot and it's very intense, dull, boring pain.
Okay, does it hurt when you move it?
Very much, yes.
I see that it's also very swollen and red. Since you say that it's deep, dull, boring, and intense, it's probably a bone and not a muscle.
Mm-hmm.
And since it hurts when you move it, it's probably a fracture.
Okay.
On a scale from 0 to 10, what would you rate it?
10.
Okay. And does anything alleviate it or aggravate it?
Whenever I sit down,
When did you first notice the pain?
well, I worked a really long shift and I noticed it during my shift. I was in my ER and
Okay. Have you had a recent sore throat?
no.
Okay, because sometimes 10 to 14 days after a sore throat pain, like that could be related to rheumatic fever.
Okay.
Should I start now? Does the pain move around from one joint to another?
No.
Okay. Have you noticed that your knees or your ankles give away when you're walking?
No, but sometimes my ankle does lock up.
Okay. Well, that could be a safety concern, so make sure you have me or one of the other nurses with you when you try to get up. And has your pain in your foot limited your activities of daily living at all?
I mean, I had to call out of work today, but that's about it.
Okay. Well, I'll communicate all of this with the doctor, and he'll be in with you in just a few minutes.
Okay.
Hi, Ms. Johnson. My name is Stephanie, and I'll be your nurse today. Can you please state your name and date of birth?
Caitlin Johnson, February 2nd, 1991.
Okay. What brings you in today?
Actually, I've been training for a marathon, and every time I run, I have really severe knee pain.
Okay.
It hurts when I run and when I move it and when I touch it with my hand.
Well, Ms. Johnson, these appear to be the clinical findings of bursitis, which is inflammation of the bursa by just constant friction around the joint. It may be precipitated by arthritis, infection, or excessive exercise, which you told me you're training for a marathon, so that could very much be the cause of it. You might just want to take it easy for a while.
Okay. I don't know why my wrist has been bothering me lately. I've been having a burning sensation, numb and tingling.
Oh wow, have you gotten checked for carpal tunnel syndrome?
What's that?
It's when the median nerve is compressed by the flexor reticulum, which is your carpal tunnel ligament, and other structures within the carpal tunnel.
Oh, interesting. Do you know what causes it?
It could be caused by just repetitive movements. You're on your computer all day, injury to your wrist, also systemic disorders such as rheumatoid arthritis, gout, hypothyroidism. It could also occur with fluid retention from pregnancy and menopause, which just obviously is not the case for you.
Oh, okay, cool. Well, I mean, not cool, but I'll have to get it checked out.
Okay, we're going to do a physical examination for the musculoskeletal system. First off, you would wash your hands. Next, you would inspect the exoskeleton and extremities for alignment and symmetry. Any irregular posture, asymmetry, or misalignment would warrant a further assessment. Next, you would inspect, for this one I need you to say.
Okay.
Next, you would inspect for muscle size and symmetry. The muscles should be relatively symmetric bilaterally. You could use a tape measure for future comparisons and make side-to-side comparisons. Any muscle atrophy or muscle mass bilaterally may indicate lack of nerve stimulation from a spinal cord injury or malnutrition. There should not be any fasciculations, which are twitches, or spasms, which are involuntary muscle contractions. Next, you will palpate bones for tenderness, joints for tenderness, heat, and edema, as well as muscles for tenderness, heat, edema, and tone. You will use the pads of your thumbs and fingers of both hands and palpate both of your patient's shoulders simultaneously, working your way distally. Use the back of your hand to detect temperature, and there should be no tenderness or edema noted. The temperature should be the same as the surrounding tissues, and muscles should feel firm. You would use this technique for palpating the legs from her hips to her toes as well. If you know any tenderness, heat, or edema, it may be indicative of a tumor, inflammation, or trauma. Following palpation, you'll observe for a range of motion for major joints and adjacent muscles, for tenderness on movement, joint stability, and deformity. There should be full range of motion actively and passively with the joint stability, but there should not be any tenderness, heat, edema, crepitus, which is crackling sounds produced by bone fragments or articular surface rubbing together. There should also be no deformities or contractures. Any increased range of motion could indicate a tissue disruption, connective tissue disruption, or any tears of a ligament or a fracture. Any limited range of motion could indicate inflammation, fluid in the joints, or contractures of a muscle, ligament, or capsule. If you suspect limited or increased range of motion, you should use a goniometer to measure the angles.